Symptoms of colon cancer. Hey there, viewer. Today, we're delving into a crucial topic that could potentially save lives: the symptoms of colon cancer. It's essential to be aware of the signs that your body might be giving you, as early detection can make a world of difference. Colorectal cancer, also known as bowel cancer, colon cancer, or rectal cancer, refers to any cancer that affects the colon and rectum. Colorectal cancer is the third most common cancer worldwide and the second leading cause of cancer-related deaths worldwide. Colon cancer is a growth of cells that begins in a part of the large intestine called the colon. The colon is the first and longest part of the large intestine. The large intestine is the last part of the digestive system. The digestive system breaks down food for the body to use. Colon cancer typically affects older adults, though it can happen at any age. It usually begins as small clumps of cells called polyps that form inside the colon. Polyps generally aren't cancerous, but some can turn into colon cancers over time. First, we will discuss the stages of colon cancer, followed by its causes and then the symptoms. Stages of colorectal cancer are: Stage 0. Cancer is only on the innermost layer of the lining of the intestine. Stage 1. Cancer is in the inner layers of the colon. Stage 2. Cancer has spread through the muscle wall of the colon. Stage 3. Cancer has spread to the lymph nodes. Stage 4. Cancer spread to other organs, such as the liver or lungs. What causes colorectal cancer? Colorectal cancer happens when there are changes in your genetic material, DNA. These changes are also called mutations or variants. Often, the genetic changes that lead to colorectal cancer happen during your lifetime, and the exact cause is unknown. But certain genetic changes that raise your risk for colorectal cancer are inherited, meaning that you are born with them. Patients with colon cancer or rectal cancer may experience one or multiple symptoms. These may include the following. So, let's dive in and explore the key symptoms of colon cancer. Number 1. Blood in the stool. You may notice obvious blood in the stool or darker colored bowel movements, which may indicate that there is bleeding within the intestinal tract or rectum. Sometimes bleeding may be present, but not visible. This is called occult blood and may not be discovered until a blood test indicates a low red blood cell count. Number 2. Changes in bowel habits. Changes in bowel habits that can indicate colon or rectal cancer include the following: new onset constipation or diarrhea, changes in frequency or size and caliber of bowel movements, a bowel that doesn't seem to empty completely, stool that is narrower than normal, even as thin as a pencil. Occasional bowel changes can be caused by a dietary change, disagreeable food, or a viral bacterial infection. However, if you are experiencing something new and unexplained, and it lasts more than a couple of days, see your doctor. Number 3. Rectal bleeding. Bright red blood in the stool typically indicates that there is bleeding in the rectum or colon, which may be a sign of colon or rectal cancer. Rectal bleeding can also be caused by hemorrhoids. Typically, patients with hemorrhoids experience symptoms that come and go with flare-ups, whereas rectal bleeding caused by cancer usually continues or worsens and is more likely to be accompanied by pain. Number 4. Abdominal pain and bloating. Stomach bloating, distension, cramps, or pain in the abdominal or bowel region can be symptoms of colon or rectal cancer. These are common issues that can also be caused by a number of conditions, including diet-related gastrointestinal distress, Crohn's disease, or ulcerative colitis. See your doctor if you experience frequent abdominal pain and bloating that does not have an obvious cause. Number 5. Nausea and vomiting. Nausea and vomiting can occur if a colon or rectal tumor is obstructing the bowel and inhibiting the passage of liquid or solid waste or gas. Bowel blockage can also be accompanied by painful abdominal cramps, bloating, and constipation. Nausea and vomiting are symptoms of a range of conditions, which may be benign or serious. If you experience persistent nausea, signs of dehydration, or vomiting that lasts for more than 24 hours, seek immediate medical treatment. Number 6. Anemia. Anemia is a blood disorder characterized by a deficiency of red blood cells or hemoglobin. In patients with colon or rectal cancer, intestinal bleeding may cause anemia. Depending on the location of the bleeding within the colon, anemia can be the first sign that blood loss is occurring. Common symptoms of anemia include skin pallor, increased heart rate, fatigue, dizziness, and irregular menstruation. Number 7. Unexplained weight loss, loss of appetite, and feeling weak. Losing weight, losing your appetite, or feeling weak are all possible signs of colon or rectal cancer, along with many other unrelated conditions. In patients with colon or rectal cancer, these symptoms are usually related. Persistent diarrhea can cause weight loss. Stomach pain and nausea can reduce your appetite so that you don't consume enough food to maintain your weight. All these issues, as well as anemia, can lead to weakness. Number 8. Pelvic pain. Pain in the pelvic area is not common in patients with colon or rectal cancer. If it occurs, it may indicate that the cancer has spread to the pelvic area. Conclusion. In conclusion, being aware of the symptoms of colon cancer and recognizing the signs that your body may be giving you is crucial for early detection and effective treatment. If you notice any of the symptoms we've discussed today, don't hesitate to reach out to your healthcare provider for further evaluation. Remember, your health is paramount, so listen to your body and take action if something feels off. Thank you for watching. Subscribe to our channel and hit the bell icon for more informative videos.